Welcome back. Mackinac Policy Conference 2025 here. You have likely heard the headlines. A budget bill passed in the U.S. House. Republicans say the bill about Medicaid will cut waste, fraud, and abuse in social services, cut taxes. Democrats are calling foul. Let's put aside the politics and actually talk about the policy and the impact on folks here in Michigan. For that, we will turn to Monique Stanton. She is president and CEO of the Michigan League for Public Policy, nonpartisan research organization digging into all things.
All the things.
Monique, set the table for us first. This bill, as passed, what would it do to those who rely on Medicaid in Michigan?
So first of all, 2.6 million Michiganders rely on Medicaid and use Medicaid. It is a foundational part of our healthcare delivery system. It's also universally popular. We had 80% positive polling related to support for Medicaid in Michigan, and that just came out a couple of weeks ago. So we know that our state likes and supports Medicaid. And what this bill will ultimately do is make it much more difficult for that individual person to access health care, and it puts our whole healthcare system at risk. You know, there's a concern that reducing Medicaid will lead to rural healthcare hospital and clinic closures. It will lead to behavioral health closures, and that makes it more difficult for everybody in a community, whether you're a Medicaid recipient or not, ultimately access care.
Yeah, we know that it has passed the House, right? Still unsure what's going to happen in the Senate. What are you watching in terms of the effects right now and the sort of work that's happening at the state and federal levels to understand impacts?
Right. So let's talk about the process. So we're talking about this as a budget bill. The reality is this is a bill that will transform our healthcare system. We haven't had hearings on it. It's not been done during daylight. Multiple hearings and sessions were really done at 1 a.m., 10:30 p.m., and good things don't happen in those hours. That's not when you have good policy discussions. And those tactics ultimately erode people's trust that their lawmakers are there working for them, that the process is transparent. And now we're seeing things where we know that healthcare will be stripped away from Michiganders. There's a concern that this will also impact schools. We see school funding cuts. We see cuts to our SNAP, our food assistance system. And all of those will ultimately have individual serious consequences for people in communities.
Are folks hearing that message, do you think?
I think yes and no. We talk about these numbers, and these are huge figures, right? And so when you talk about $700+ billion, it's hard to translate to what that means to an individual. And what that means is you might not be able to get access to your primary care doctor. So you end up showing up in the hospital because you have unmanaged and untreated diabetes. It means that that substance use disorder clinic that you relied on closes or has less access to care because you no longer can get treatment, or your family member, your child can't get treatment when they need it. And so ultimately we know that individual people will be harmed by this.
When you hear folks say, well, really what this bill is doing is digging into the waste and the fraud and the abuse of Social Security services and systems, what's your response?
I think those have just been very loud talking points. The reality is that Medicaid recipients, that's not where fraud takes place in the Medicaid system. And so if our congressional leaders were really serious about addressing fraud, they wouldn't be putting in work requirements to take away health care from people. Adding more bureaucratic steps. The reality is that the majority of improper payments in the Medicaid system are related to documentation issues. It's oftentimes on the provider side where there's fraudulent billing taking place, and this bill does nothing to address that.
If it goes to the Senate and is passed as is, or there's some changes, we could assume that there will be a large amount of money taken from the Michigan budget, right? And then you have budget leaders, and I'll be talking to Jen Flood, budget director, about exactly this, but you then have some holes to make up. And there's some decisions then that have to be made about, do you pull from another pot of money here in Michigan? Are you at the table having any of those conversations? What are you hearing about where other cuts could come from to try to figure out this giant hole all of a sudden? sudden?
Well, the reality is the state relies, 42% of our state budget is federal dollars. There isn't a magic hole or pot of money that we'll be able to take dollars from. And to put this in context, when we talk about the SNAP changes and doing a cost share, SNAP is our food assistance program, and that has universally, historically been fully federally funded. We now, with the requirements that they're putting in, it would require the state to come up with between $760 to $780 million. That's roughly 80% of the size of the Michigan State Police budget. And so the state doesn't have extra money to magically plug these really important holes. And I also want to echo that federal dollars are our taxpayer dollars. So the dollars go back up to the feds and then come back to Michigan. So these are our dollars that they're taking away from us, frankly, to make some really significant tax cuts for ultra-wealthy individuals.
And we should note, unlike a few years ago when Michigan saw this $9 billion budget surplus, much of that having to do with federal dollars from COVID relief, we had the Consensus Revenue Estimating Conference just a few weeks ago in Lansing. This is where the State House, the State Senate, the Treasury come together with how much money the state is going to have. And there was $300 million less than predicted in January. And we're sitting here amidst conversations about what tariffs could mean for the economy as well.
So as we're looking at a really unpredictable time for the state budget, for healthcare providers, for school systems, for the business community, and one thing that the economy needs is predictability. And so the stress around what are the federal cuts going to be? What are the cuts to our education system? Are people going to have access to college scholarships? What's the tariff impact? It makes everything very unstable and unpredictable, and it makes it more difficult to invest in this current moment.
Monique, in about 30 seconds that we have left, what is your message then to the folks that are here at the conference right now in this moment?
So healthcare is necessary for everybody, whether we're talking about employment issues, whether we're talking about education, whether we're talking about boosting our economy. And when we destabilize our healthcare delivery system, it will make it much more difficult for Michiganders to survive and thrive. And it'll also make Michigan a less welcoming place because more people will be struggling.
That is Monique Stanton. She is with the Michigan League for Public Policy, filling us in. Always appreciate the time, Monique.
Great. Thanks for having me, Zoe.
And we are going to take a quick break. We will be right back.